Okay, so Marian is not here because she's counting the votes. Aha. In the break, she has the answer, she goes. So, in the break or at some point, Marian will come and tell us what's happening with the results. And you know what votes I'm talking? It's not about elections, eh? I'm not elections, Canada or Ontario. Okay, so we are going now to review both the provincial platform and the federal platform. And I am going to ask the following people to join me at the hot seats, starting with Madame Immediate Past President, Dr. Claudette Holloway, who in her turn will talk about nursing. Come on, please, Madame. Then I will ask Madame President NP Lamodolkar to come, and she will discuss healthcare system. Please, not yet. Thank you. And then I'm going to ask Deb Lefebvre, Deb, somewhere, Deborah. Okay, who will speak about social determinants of health. And then I'm going to ask Rob Samalak to speak about environment, determinants of health and climate change. And the way we will go is I will speak how we develop the platforms in general and these ones, and then we will go through each one of the pillars. First, we will do provincial, not because we are going to influence your vote, or you will be able, well, you still actually can. Can we all be together, please? So you all can influence still the votes, because I hear people are telling me they're still even the parties writing to them, so surely you can. And if we can be together, please, because for our colleagues, and it's distracting to others, if you all can take care in your tables to ensure that we're all together, please, thank you. And then we will talk about provincial first. We will not allow questions at that point because there are some or a lot, depending on the item, similarities between provincial and federal. And then we will talk about the federal second. Now, our colleagues remember that if you are so inclined, you can pose a question before you speak about your portion. And first come, first gift gets a gift. So you can still think about questions, one, because I don't know how many are left, but people jump really fast. And then we will do, then we will open for questions. Let me tell you first a bit about, I should not have put, and I would have asked you a question. Why is it different people have different perspectives? I was talking with a few staff, and different people have different, very different, in fact, perspectives of why we develop a platform. Can anyone share why we develop a platform? Erin, please, thank you. Can anyone share why we develop a platform at RNAO? It has been 2 decades that we develop a platform, a bit more, 25 years perhaps too, because we started them a year after we started Queen's Park Day. So here you go. So the first election after. So can anyone say why we develop a platform? What's the rationale for it? Anyone?
We have to set a platform in order to keep focused on what our focus in, our scope. Otherwise, we can get all over the map. And the electorate, that's the people, as well as the politicians, need to know what we as nurses and nursing care needs in order to move forward. Thank you.
Dot, bang on. Did you get a gift before, Dot? No, come get a gift. Okay, go for it. Go for it. Now, no second gifts, eh? So go for it. Absolutely, yes. It doesn't matter which government is being elected. RNAO stay very true to our compass, right? Of what we think about all these 5 pillars from ever. 25 years has been these 5 pillars, the same 5 pillars. What changes? Actually, Rob, you will be interested on that. Environment came later, right? Was not even in the discussions of anyone, unfortunately, 25, 30 years ago. That's why we are in the mess that we are. So is to stay with our compass. We are not changing the compass according to who is the government of the day. We continue to push on the same, which brings the second issue. Elections are happening today, right? So why to talk about the platform today if elections are happening today? Who can share? Why are we talking about the provincial platform today if elections are already underway? Go for it. There is a hand here, a hand here, a hand there.
Regardless of who wins the election today, we still have 4 years to hold their feet to the fire, according to this platform.
So we have still the 5 pillars to address: nursing, right? Health system,
Climate change,
social determinants,
social determinants of health,
which is linked to the issues you and I and others have been talking, right? On the issue of the upstream addressing of the opioid poisoning, not crisis, and then environmental, and then what's the 5th? I will be talking about the 5th at the end. What's the 5th? What is it? Oh, it's there. What can I do? That's life. Why is this going alone? This is bizarre, eh? I'm not touching this thing. Anne-Marie, don't. No. I don't know where it is. Okay. I thought, hey, I got an email. I'm not going to say from whom. I invited the person to join us. And the question was, you mean next week, right? Because this week is elections, like today, in case I didn't know. I said, yeah, I know, but we actually, so not next week, we are gathering now. Just get in a cab, come, it's not a problem. Are the politicians there? One of our colleagues said yesterday, are the politicians there? No, we couldn't because we left them out, because it wouldn't be even normal to get them today. Who knows what will happen? So no, we don't have the politicians here. I said, but we are plotting, and you want to be part of the plotting forward. So that's part of why we have today also, despite elections, and what Dot said is very true, because we'll remain with the same, right? That is in the platform. Some of that you will see in ECHO also, is because we want to influence forward more. What's the time frame to influence, you think, a government, opposition parties with this provincial platform? What's the most urgent timeline? You got it. And then the first year. So you get the prize, go. You get the prize, go. Go take your prize, because it is the first 100 days, the most challenging things, and I will be talking, some of my colleagues we will be talking about what to expect towards the end of the presentation. Very good. Anything else of why we do a platform? What guides the platform? What guides the platform of RNAO? Yes, what else? Let's give someone else. Sorry? Data? What else? Values. Who sets that? All of you. But you know who? The board. That's where the ends of the board, if you go back to the ends of the board, right, that speaks about values, speaks about not-for-profit, speaks about diversity, speaks about all of this. Look at those ends and look at the values. You can Google RNAO's values, you will see them for a long time, and we've had tested them, the values of RNAO. And also the ends come back to the board. And there could be a board, I wouldn't be in that board, but there could be a board that changes completely the ends, right? That decides that, for-profit is a good thing, even if data that one of you mentioned says it's not. So this is why members need to keep their eye on who they elect as board, and why boards need to stay accountable to actually the organization delivering through the CEO, who is a member but non-voting member of the board, that we deliver actually what are the values of RNAO, right? So it's very, very important, and that's why we will continue to push with the platform. And when the colleague that wrote to me said, but today, I said, yes, what better day than today to plot on where we will push next. So that's with the provincial. With the federal, why it's important to tackle and address the federal, which we will talk later on. The rest is all the same. The rest is all the same. What Dot spoke about, the compass, right? That we stay true to the path regardless of which government will be federally elected, et cetera, we remain with the same values, whether it's federal, provincial, or for that matter, municipal, right? So why is so important in the case of the federal elections that we do it now?
Because the federal election, basically goes back to the provincials. If you have a federal government that's doing well for healthcare and whatnot, then the provinces will come along. But if you don't, then you have a mess, because then you're fighting against each other.
Right, very good. So let's start to speak about this. So the platform, in its first draft, following the same areas and as always, and following the values of RNAO, the ends of RNAO, came in its draft to RNAO's board several months ago. We had great discussion, and what you see, of course, is the final products of the platform. And now it's not for discussion if these are the right or not the right items that we have. It's likely more than we can chew anyways. But it is, so we use it to mobilize people. So today we will review the content. Tomorrow we will do how we will mobilize our members in the different regions, and we will talk about that tomorrow. And Alana and Anne-Marie and I and others will be chatting about that with you. So, values. Okay, you see it here. Who can share? What does it say? Any of you. Because if you do that, you will remember all of that way more than if I am the one repeating that. Who can offer to just tell everybody what are the values? Yes, please. Thank you so much. Thank you, Helen.
Oh, thank you. Oh, thank you, Morgan. What do? We advocate for healthy public policy. So what's healthy public policy? We need an elevator pitch for healthy public policy, right? You got 60 seconds to say it. Promote excellence in nursing practice and empower nurses to actively influence and shape decisions that affect all of us. Or empower nurses to actively influence and shape decisions that affect all of us. Speak out.
Very good. So first of all, we promote healthy public policy for the students, Healthy public policy, that is why we speak about social determinants. That is why we speak about environmental determinants. Without that, you cannot have healthy public policy, right? That's why we speak about EDI, right? And in terms of powering up nurses, is because it is the collective that needs to go and push. Not having the funding to do this, that's never the problem. Having the political will to do the right thing for the majority of Ontarians. Healthy public policy means also a system that serves everybody, not only the haves in our society. And what do we believe in? Someone else, please? Give it to a student. Give it to a student. Let's have a student. Here, you have here. Tell us who you are and go for it.
My name is Mateen, and I'm from the Wellington chapter. So the next part is, what do we believe in? We believe that health is a resource for everyday living, and healthcare is a universal human right. We also believe to
Can you tell us what does that mean?
like healthcare being a universal human right?
Both. Health is a resource for everyday living. Let's stick with that for a minute.
So my interpretation of this anyway, that health is a resource for everyday living, it's something that will affect your day. From the moment you wake up to like the moment you sleep, how you're physically feeling, whether that be emotionally, mentally, whatever, it's going to affect you in your day. And so in that regard, it's a resource that you will use every day, and it's important to prioritize that. And I think that fits into the second piece, that healthcare is a universal human right, that if we establish that and we all believe in that and we all respect that value, then the first part comes naturally.
Very good. So first of all, no person here could have said it better. Health is a resource for everyday living from the moment we wake up till the moment we die, in fact, right? If you don't have it, that's why it's a resource, right? For everyday living. If you don't have it, and picture when we will be speaking about difficult issues like ODSP, difficult issues like substance use or opioid crisis or opioid, however you want to call it. If you don't have health, it's difficult to live, right? Or it's more challenging to live, or it's more, right? So this is why health is a resource for everyday living. And then, as you said, this is why then healthcare is a human right. Now, healthcare is different than health. Tommy Douglas used to say that healthcare is necessary to patch up. Do you know who is Tommy Douglas, the students? Do the students know? Any student that knows who is Tommy Douglas? Only a student. Here you go. Here you go. Go for it.
Wait, no, I'm thinking the wrong person.
Okay, who is Tommy Douglas? Okay, we need to go back to all our schools. You have a student there. You have a student there.
Tommy Douglas was the person who founded Medicare, which is basically free public health care.
Not free. It's not free.
Well, not
it's paid
free,
from
but
our taxes,
Publicly funded, sorry.
which is important, right? We all pay for it. Some pay more, and I will talk about that during the fiscal accountability or fiscal bucket. Some pay less. That's called progressive taxation. And so that's why it's not socialized medicine, it's not free medicine, it's healthcare for all, universal healthcare, which the people in the US are scared to death, and that's why they want to destroy it, because they don't have it. That's the reality, and that's why we need to protect it all the time, because if we were fantastic about social determinants and environmental determinants, we will not need really healthcare a lot. We will need aspects of it from time to time, But unfortunately, we are not as good with social determinants and environmental, so we need this healthcare system when we basically, people get ill because of the illness of society, of not taking good care of social determinants and etc., that they get, as Tommy Douglas used to say, patched up by the healthcare system. And it's a universal human rights, right? Fantastic. So next one, values, powering up, right? Next one, respect, go for it. Go. Unless another student takes the mic from you, you're it.
The second point is that we believe respect for human dignity and commitment to diversity, inclusivity, and equity, social justice, and democracy.
And this is way before it was in fashion to talk about EDI. This has been there for many, many years. We address these aspects of human dignity and of equity, diversity, inclusivity. Yeah, next.
And the last thing is, we believe the leadership for every nurse to advance individual and collective health.
Which means all of you and all of your colleagues, whether they are members of RNAO, whether they are here, whether they are in the workplace, where they are the retired, wherever, right? And if we can influence the public, even better. So the federal, yes, we can influence the public. So don't stick only in the federal one to talk about, the aspects that we are covering. Also talk about the why, about especially that first one. Health is a resource for everyday living, and healthcare a human right, and some people in the public will look at that, what is he talking about? And you can explain, and once it clicks with people, they will never forget it. And they will start to act as a collective. We act a lot as individuals. What's good for me, what's good for you, what's good for you. That's not important, it affects our families, but more important than that is what affects the collective. Because you know what? If it affects the collective, sooner or later it affects you, even if in that moment doesn't affect you. It will come to affect you at some point, right? So it's critically important. So let's start then with the bucket about what does RNAO want? Someone else. Okay, we started with the students. We don't have the middle cohort. Let me go from age 25 to, I don't know what's the middle cohort, 40, 35, 40. Here you go. We have a volunteer. Go for it. That's okay.
We seek meaningful change and change that benefits all. So we want to enhance health and well-being for all persons. We want to strengthen solidarity and social cohesion. We want to promote the common good and build a brighter future for everyone.
Very good. Remember we spoke last night about the being together, solidarity amongst everybody. How many people are privileged, like you at this time, all of us here in this room, reflecting on the elections day, taking a day of work or a day of life or a day of whatever, being brought to RNAO, discussing issues that are important. Most people cannot, not just not afford that from an economic point of view, afford the time, afford the energy. Some are not interested, so you got it. Next.
We reject the change that's rooted in misinformation, culture wars, division, targeting groups, and erosion of human rights. We reject change that's rooted in harming the social determinants of health and threatening our ecological future and disregarding the common good for the profit of a few.
So this is critically important in the context of elections in Ontario today, and equally, if not so more, even in the federal. It is very clear that some of the aspects that RNAO believe are important, i.e. the safe consumption sites, are critical for people, and they're all being closed. Just so you know, RNAO is taking legal action. You may not know, because I don't know how public it is yet, but we are actually taking legal action against the government on this, and with the coalition of other groups. So I go back to what Dot said before, not because it's Dot, but because what she said is very important. We stick to what RNAO believes, regardless of what's the government. We stick to our values, we stick to health for all, we stick to what's important, and sometimes it will be clap, clap, clap for whichever government. You will hear some clap, clap, claps in things that that government has done, and sometimes is scream, 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 and sometimes it's legal action too. And it wouldn't be the first that RNAO does that. Someone else to the next?
I was picked randomly, guys. Okay, we support politicians who share universal values and demonstrate democratic accountability, show commitment to healthy, diverse, inclusive, equitable, just, and democratic society. And the way you pass our test is we weigh actions, not words. We look at the record, not at promises and rhetoric. And we check who their core constitutionees are.
That is very important. All of it is important. So
I read that wrong.
It's very important that you see, first of all, it's very important that you see who the constituencies, right? You saw that just by the way now in the run-up to the leadership of the Liberal Party. I think we spoke a bit yesterday about that one of the candidates was disqualified, by the way, not by the Liberal Party, even though she wants us to believe that's the case. She was disqualified by actually Elections Canada. And it was interesting because it was discovered that people that donate, donors, were the main, against the rules, by the way, the amount of money, donors for her campaign. And so when you know who are by the way, when people donate to parties, which any of you are welcome to do, we cannot say yes, we cannot say no. When people donate to candidates, it's public information. So by looking at who are the donors, you kind of know, well, is it only the people in the business, big business community? Is it only the people in IT? We know, for example, with Elon Musk, et cetera, that has a bit of influence on that. Or is it smaller donations from a lot of people that actually will impact that? It tells a lot to know who are donors. Okay, so now we are going to go to the 5 pillars, and I'm going to ask Madam President, past President, immediate past President, Madam Dr. Holloway, to come and talk about nursing. And here is what you do. You click, click, click. Just for the next one is nursing, so you will have that one. And we will do federal.
Well, I'm getting old and that is in fine print, so I try to get with the technology and have it on hand here. So thank you, Dr. Doris Grinspan, for that overview. And the first pillar, I have 5 minutes of time to talk about the nursing platform. And that is about addressing the nursing crisis by implementing measures to retain and recruit registered nurses and nurse practitioners while ensuring healthy and supportive work environments. Is it on your screen? Good, very good. So this is a few of our calls for action. So to have a call, you've got to have a voice. So each one of us have to speak up. As Doris said, that election is already on the way, but it doesn't mean that you don't need to pay attention for the provincial platform, because you need to be more informed for the next time, and in the next 4 years we still have to advocate for these issues. So this platform is divided into 3 areas: retention, recruitment, and healthy work environments. Under retention, guarantee competitive compensation for nurses. We are valuable. We're not asking for anything that we don't deserve. We just want to have competitive compensation, comparable to other jurisdictions such as south of the border. I am not saying that name anymore. Next thing is to harmonize pay upwards to tackle disparities in primary care, home care, and long-term care. We also need to ensure safe workloads by increasing nursing staffing and support across the healthcare sectors. We don't want to have our nurses being sick because of the jobs that they are performing. We need to expand registered nurse scope, ensuring RN prescribing is integrated into every single baccalaureate nursing curriculum, BSc programs. And we want to thank the government that after 12 years, we finally got the answer. So please know that when we ask for things, maybe we don't get it right away, but we don't give up. We continue to knock on the door. And thank you, Doris, for leading the way in always knocking at the door and bringing the issues forward. In the halls of the legislature, I remember a couple of years ago being interviewed by a TV station, and they said they admire the way that RNAO always has a measured and professional approach to our issues. So we don't go putting signs on people's lawn to burn things and make our point. We will address it in an appropriate way, and what better way than healthy public policy. We want to guarantee fair wages, predictable schedules, and access to benefits and pensions for part-time people. We may be young now, you may be young now, but there's coming a time when you're going to need benefits, you're going to need pensions, so we need to get it started right now. And we want to protect the temporary and other precarious workers. Under recruitment, we need additional seats in nurse practitioner programs and in baccalaureate nursing programs. Yes, the government has done something about that, but as you can see from the presentation from our Director of Policy, Matt, and his team, that there's so much more to be done. Folks, we cannot, in all conscience, just sit by and let things go. We have got to address it. It's affecting every single one of us. And the worst off for the poorest person is the worst off for all of us. So let's get everyone in an equitable state so that we can achieve health for all. The last thing is healthy work environments. Address racism and all other forms of discrimination. This is huge. Racism, anti-black racism, discrimination has a tremendous impact, not only physically, economically, but on the emotional and mental health of individuals. Raul reminded me that we are still in February, Black History Month. I hope that you've taken time to look at the videos that were produced by Raul on our RNAO website. It's very important. As we speak, as we stand here, people are not able to achieve their full potential because they're being eliminated from the way they look, the way they sound, or whatever decisions they've made in their life. And we need, as nurses, to stop that. We can't address the whole population, but we can make a start in nursing and that will filter out to our whole society. So Doris said I should have a question for a prize. And in light of Black History Month, I want to ask you, who was the third president from the Black community of RNAO? I said the first is too easy. The third.
Dr. Angela Cooper Brathwaite.
That's right. Who was the first? Who was the first? I think, Ed, you need to get your prize, right? Who was the first? Just one prize. There's no prize for this now.
Joan Lasmond.
There's no prize for this now. Thank you, Edward. But who was the first? No.
Joan Lasmond.
Pardon?
Jocelyn Hezekiah.
Hezekiah. Dr. Hezekiah, now 90-something years old and still going strong. Who was the second?
Joan Lesman.
Joan Lesman. Who was the third? Dr. Angela Cooper Brathwaite. She is trying to write her memoirs, but you keep calling her to present, you keep calling her to write, they keep calling her to teach. She's a fantastic Order of Ontario, Order of Canada. And at RNAO, let's always appreciate our leaders and those students who are coming through. Yes? We have Morgan that started as a student. We had Lamo that started as a student. So many of you can do so much more. And we have nurses who are running in elections. And we need more of that. One of these days, not so far from now, in that very chair that we took pictures in the Premier's office, I want to see a Minister of Health, even the Premier, sitting in one of those seats. Thank you.
So my next question is, who was the fourth Black president? Okay, so that brings to my section, the next area of advocacy, which is the health system transformation. We heard a lot about it today, especially that was presented by the policy team headed by Matthew and his team about ECHO, right? That's a big portion of the health system transformation. And these are information that is derived from frontline nurses, patients, families that are receiving care, and many others like myself. And I think it's important for us, especially this time with the federal elections that can be announced anytime, like the provincial election sprung on us. I think we should be ready with our, I don't want to call it agenda, but these are our issues, like Dot explained. These are the things that we go, because when we go to politicians with many things, because we see many gaps, but we need to be focused. Politicians have tight line, and they want to focus. Tell me the first three or the first two or whatever that may be that we can work on. And I think that's a very strategic direction that we need to focus on. So going through the, we're talking about the provincial.
No, federal. No, provincial. Provincial.
So we're doing the provincial. So the provincial election is happening. It's still till 9 p.m. But what we need to focus on, this is the direction that we're going to go. The first 100 days to the first year is the most essential, and we need to meet them as soon as they're elected and maybe drum on the agenda that we have for them. So ensure a health system that is accessible, that is equitable, that is person-centered, integrated, and most importantly, not-for-profit, publicly funded healthcare system. And I think that's really important because as Dr. Holloway keeps on mentioning that we need to think we are young now, but we won't be young forever. And the same thing for every consumer of healthcare, that we should think strategically about not only ourselves, but for others as well, and that's how we'll all grow together. So some of the calls for action is the system issues. We've spoken, as RNAO has always spoken on various media platforms. The Provincial platform was, I guess we presented our Provincial. I was there when, on CP24, on a live interview, and that was the day when the elections were called. And the host asked me, as part of RNAO, do you have something that's coming up? Because RNAO is known to present the election platforms, like always. And these are the directions that politicians take when they present their platforms. And I said, yes, it's coming up on Monday. This is the value of your organization that is out there in the political diaspora. People take, all these politicians take tips from our election platforms and they run it by, just because nurses are the backbone of the healthcare system. It's the majority, I guess it's 65% of the healthcare workers, all nurses, maybe more, and expanding. So we need to ensure that we protect our publicly funded healthcare system. We need to ensure that hospital wait times, like the ER wait times, are lessened. But when we say that, it is dependent on a lot of factors. So we need to strengthen our primary care, which we'll talk about, as to how to reduce the wait times and also focus on patient-centered care. Clear surgical and other backlogs, not by offering for-profit surgeries, but to ensure that our nurses who work in the publicly funded healthcare system conduct surgeries in timely manners in hospitals and other settings. The expand dental care. It is interesting to know that when we talk about federal platforms as well, that the first year when the dental care was announced, the first year, the number of seniors that used dental care was so high, was significant. And you know, this speaks to the importance of why dental care is important. Kudos to our RNAO members like Poonam Sharma, who worked in public health care, and Una, who talked about the importance of oral care, brought the resolution forward, and RNAO has been strongly advocating for universal dental care. You know, these things that show up as policies or you know, programs that are announced, it is your work through RNAO that is actually being implemented. So kudos to all of you for that. We should also advocate to expand the mental health services, like the safe supervised consumption sites that are being closed in March, not too far. I think these are issues that is all going to percolate in our ERs. If you don't work in mental care, you don't understand the importance, maybe, but you will, if you work in ER, you will understand that all these patients who are, all these individuals who use substances, if they are not provided harm reduction strategies, they will all end up in ER or may die unknown, you know, no one for them in alleys and, you know, lanes, and this is at the cost of all your tax, of all you taxpayers. So we have to be very strategic. It is, people say this is not my problem. It will become our problem, I always say that, and hence it is always better to be proactive and continue to advocate for these issues. Then community care. So the ECHO model, ECHO model 4.0, I think it's important that this was a trailer today, but it's coming. And governments need to understand that our health system should be anchored in primary care, and we should strengthen our publicly funded healthcare system and also public health. This is an upstream strategy that needs to be looked at. Then we talked about primary care, and we talked about the importance of attaching every individual or families to a primary care provider. I want to emphasize, look at the different political leaders that are coming up and, when they present their platforms. Do you hear nurses? Right? This is your chance. This is an opportunity for you to drive in the strength of nursing. I didn't hear nursing at all in all the election platforms, maybe one or two maybe, but all of them talked about family doctors. Not against doctors, I love them. I mean, they're great, but it has to be in partnership. Nursing is an essential part of the healthcare system. Doctors are nothing without nurses, and vice versa. So I think we need to advocate for that. When you, as all of us, I think it's a responsibility, whether it's a nurse practitioner, whether it's a registered nurse, whether it's a nursing student, we are all part of the nursing profession. So your responsibility as well, you do not have to say family doctor always. Use the term primary care practitioner, because you are being inclusive of the nurse practitioners who are also part of the system, who also provide primary care. We need to also strengthen and advocate our home care. Lots of issues in home care right now. Yes, we moved to Ontario Health at Home, but then what are people actually receiving home care? Right? The wait list times. I work with geriatrics. The 4 hours of PSW, the home care coordinators find it difficult to allot PSWs. And if it's a remote area, forget it. You're not getting it. Because there's one PSW that goes, for I don't know how many homes, it's 15 minutes, 15 minutes, 15 minutes, 15 minutes. How are they going to ensure that the person gets personal care, the patient is mobilized, the patient is, they don't administer medications, but the person does get basic care. It's not, and these are all our taxpayers. You have to understand that. So you need to advocate for home care, because there is not a lot of long-term care beds, right? The wait list time, my personal example, I have patients who were told that if they want a long-term care of their preference, it's from 5 years to 17 years to an 85-year-old person. 17 years. This could be all of us. If we are, if we don't have supports at home. So I think it's important, right? So hence we need to ensure that home care is there, but the long-term care sector also needs to be looked at. What about those senior individuals who are in long-term care? Are they receiving care? They're attending a physician or whoever that may be. They can't find them. RN prescribing is a way to alleviate the burden there, and also ensuring that nurse practitioners are also there working in long-term care homes is also important to ensure that our seniors also stay well. Adding infrastructure, adding beds is not going to solve the problem. Healthcare is a human science, and we need to invest in people. We need to invest in humans. And I think you being there in front of political representatives, making them understand, because you are the frontline person, not them. I think that will go a long way. So that brings to the end of my platform here. And then I have a question. Okay. What is one of the best things that has happened to nurse practitioners in Canada? I'm going to ask someone who's not answered. Is that okay? Is that fair? You're where Morgan is, I think.
Hi, it's Margarita, Halton chapter.
Hi.
And it would be that nurse practitioners right now can run their own practice.
I can't hear from here, sorry. What did you say?
They can open their own practice.
They can open their own practice? Anything else?
I'm not sure if this is the answer, but didn't they have their scope of practice increased to be able to do like diagnostic testing, and there was more of their scope that was... Yeah, somewhat.
Elaborate. Yes, Kamala?
Yeah, Region 6, yes. I would say they can build through OHIP soon, very soon.
No.
No?
So, yeah, you're close. So are you, Sonia. But who? One more there?
Hi, I'm Kirsten, Nursing Students of Ontario. It has to do with billing, but it's somewhat like that. So I just don't know exactly the correct process, but it's...
Okay. Very close. You guys are coming very close. Yeah, one more.
Preet, and I'm from representing Waterloo chapter. I think what we were talking about, everybody was mentioning, it was the mandate which says that the nurse practitioners, starting next year, they could have OHIP built in the billing when they are going to see the patient, and also nurse practitioner will be the DOCs where they can be seeing patients in the long-term care. Right now there's not many nurse practitioner becoming DOCs. Another thing is I've seen a lot of nurse practitioner already in the hospitals when they are working alongside with hospitalists.
Okay, so clarification here, right?
Mhm.
Like
Maybe
yeah.
without giving the answer.
Yeah.
Okay. Let's start with the easy one. Hopefully it's easy. What's the name of the Federal Minister of Health? Yes, Mark. Okay, good. What letter did he send in the last, I don't know, 4 months? 3, 5, something like that.
Yeah.
Go Google. Ask Miss Google.
Is it about the change to NP education? So all the nurse practitioners are now going to be trained as general practitioners as opposed to specialists?
Yeah, I think that's the closest.
And that's why I said read the slides.
Yeah, so that's the
Read
closest.
the
Yeah.
slides.
Strengthen NP role. So I think the letter is of interpretation by the minister, Mark Holland, which said that they want to change the how the publicly funded services are being paid through publicly funded would now include not only physicians, but also include nurse practitioners, midwives, and pharmacists. So I'm going to talk about nurse practitioner because we are nurses, but that's what it is.
And it's not, be careful of not saying OHIP.
Yeah.
First of all, I want to ask you, if you were a doctor, would you allow nurses to just go into your OHIP? So what the minister said is that the governments, you know the date, it's not far away. By March 2026, all governments of this country, provincial and territorial, need to have a mechanism where nurse practitioners and others, like pharmacists, midwives, etc., that can have the broader scope, must be paid through the public purse. He didn't say how. Must be paid to the public purse because they will not allow, some of you spoke about this, for user fees for NPs. That came, interestingly enough, also because of RNAO. Because RNAO was pushing Minister Sylvia Jones to create a pot of funding of 10 million for NPs to be able to access, to set up NP clinics, if they couldn't access other things like community health centers, NPLCs, etc., to basically be able to work with patients without user fees, because we had some NPs and some clinics popping up here and there charging patients, which RNAO does not support, right? So we went that. And then Minister Jones, which is Sylvia Jones, which is is, I guess, until she is or is not. It's the only one I know for now. Minister of Health, she actually sent a letter to Minister Holland to say, please interpret the Canada Health Act, because you had people from outside saying, well, you know, the Canada Health Act allows that because it doesn't say no. Or we were saying the Canada Health doesn't allow that because it's not only the letter of the Canada Health Act, it's the spirit. And the spirit of the Canada Health Act is not for profit. So then Jones sent to him, and he did the interpretation for the entire country. And this is why Jane Philpott, who I think one of you mentioned before, Orioneko, that was appointed by the government to lead primary care, now she's saying is a family doctor or a nurse practitioner that need to be the only ones that patients are attached to, working with teams of people. So did anyone get there?
Yeah.
Here you go, prize.
Yeah. So the prize goes to you, my friend. Okay, thank you. Yeah, I will hand it over now to Deb to discuss the next provincial platform.
No, I did already, but I did want to talk about Madame Lamo.
About me?
Madame, about you.
Okay.
About you, with you. NP Lamo Dolkar. Look, not a single note, eh? I think that what Madame Claudette Holloway said about someone using the Premier's chair one day, or, you know, we already have a minister, so we can't go for a minister. We need to go big or go home. For a Premier chair, would you vote? I think we can support her. I would vote. Okay, we have the plan.
Okay, thank you.
So do I just push the button here?
Yeah, push the button.
Okay.
Only one.
Only one. This one?
This one.
Oh, thank you. All right. Okay, my name's Deb Lefebvre, and I am a board representative representing Region 9. So I'm from Kingston. Hello to my gang over there. And also Seaway and Champlain and Leeds, Lanark, and Granville districts, chapters. So I'm going to talk about the social determinants of health. And before I begin, I'm going to ask you my question at the beginning. So some time ago, we had 10 social determinants of health. And as you know, Doris has mentioned, life changes, society changes. Circumstances change. Can anyone tell me what the two new social determinants of health are? We have 12 now. Anybody? Come on, there you go. Thank you, Poonam.
The environment, and is it Indigenous health?
You're kind of close.
Social determinants of mental health?
Inclusivity, yes.
Social determinants of mental health?
I wish, working in mental health. But racism,
accessibility,
and, inclusivity, so newcomers, living in Canada. So in that spirit, as you know, RNAO, we're selective. We'd love to embrace all of the social determinants of health. And I want to thank Matt and his team for really narrowing it down and giving the leadership the tools to show that we are science. We are, as Lamo mentioned, yes, it's human science, but it's always about evidence. And that's what really sets us apart. And I want to thank Doris with the introduction of the BPGs like 20 years ago, because she took, nursing as an art or compassion, but then really nailed home that it's about science and it's about the evidence. So we have 5 of the 5. Sorry, I got a little confused there with all those bullets. The provincial side, so there's, as you know, 3 levels of government, and some of these SDOHs overlap. So I think about housing. So housing, provincial legislation, provincial mandate, but also federal, and then there's that municipal layer as well. So let's just talk about housing. We saw today from our policy individuals that I think it was 80,000 people live precariously, or they do not have a place to call home. And I don't know about you folks, but I moved from healthcare administration. I'm a former director at Kingston Community Health Centers, and we worked a lot with vulnerable populations. And a lot of what I saw this morning and I've been seeing over the years really is kind of resembling the KCHC model or CHC models, interdisciplinary, cradle to grave, wraparound service. But how many times, and maybe some of you can identify with what I'm talking about, where we get a patient, because I'm back in patient care, and we fix them up, we get them, to a place of their best health outcome, only to discharge them back into the very circumstances that brought them to us in the first place. They're homeless. They may be using substances. So homelessness and housing is such a critical social determinant of health, as they all are, really. They shape who we are. And then if we talk about the ACEs, that's a whole other conversation. And then we talk about, I'm going to focus in on Indigenous peoples, because I only have about 5 minutes, okay? So yes, strong communities, absolutely. Where you grow up, do you have access to, education, good, healthy relationships, all of that stuff? That's important. Indigenous peoples. We saw the stats. Did you know the birth rate for Indigenous people is 39%, non-Indigenous 5%? Think about the potential when we build them up, when we give them what they need to not survive, but to thrive. I work with Indigenous peoples, and honestly, it is Canada's third world in so many northern communities. And the level of addictions and substance use, because kids don't have what they need to stay busy, to thrive. So, you bet RNAO is on this one. It's what we have to do. And collectively, we are such a strong voice to move this forward. And Doris and her team, they're hammering on those doors to have them listen. And then EDI, equity, diversity, and inclusion. So you all know about the Black Nurses Task Force. I had the distinct privilege of representing the board as a liaison to the Black Nurses Task Force. I learned a lot, like so much. It was a real privilege. But RNAO, it was behind that, and we were one of the first, as we are on so many platform issues. Black birthing mothers are twice as likely to die than others. That's abysmal. So we need to do better. RNAO is bringing this platform to our provincial, whoever it is. I've been hearing rumors who it might be. Because we're nonpartisan, it doesn't matter who gets into power. We're strong. You're going to hear me talk again about the federal piece. kind of like repetitive, but it's important. Thank you.
Bonjour tout le monde, je suis Rob Semilak, je suis le chef de les infirmiers et infirmières de l'Ontario de l'environnement et je suis très fier que l'AIIAO a le leadership d'avoir les déterminants de la santé environnementale dans la plateforme électorale. Hello, everybody. My name is Rob Samuelak. I am the chair of the Ontario Nurses for the Environment, and I am very proud that the RNAO is a leader within healthcare organizations promoting environmental determinants of health in the election platform. So, I want everybody to pick up their phone, put it in the air, in the back of the room. Pick up your phone, put it in the air. Now put it face down on the table. Close your eyes. Well, Paul Andre is scared over there, but we won't freak him out too much. Now, go back to your Introduction to Nursing course, and you were taught about Maslow's hierarchy of needs. The bottom of that was physiological, and the top of that was self-actualization. Now, you can open your eyes again, but you can leave your phones on the table if you want. So, we started talking about RNAO. RNAO is like the very, very top of that pyramid of needs. Below that is the next pillar. You need a strong nursing workforce and a strong nursing profession in order to have RNAO. Below that, you need a strong healthcare system to support nurses. In order to support our healthcare system, we need a healthy population so that we are not overrun with the burden of disease, so we need social determinants of health. However, fundamental to all of those is environmental determinants of health. If you do not have clean air, clean water, and clean soil or fertile soil, then you are not breathing properly, you're not drinking healthy water, and you cannot grow nutritious foods. You need environmental determinants of health to have healthy people. So it is fundamental, and I'm very proud that RNAO has this as the electoral platform. So let's go through this. So I can't see the top very well. Improve health outcomes by building a low-carbon, just, and equitable economy, phasing out fossil fuels and addressing pollution. So climate change is the biggest thing affecting us right now, or climate crisis. And the climate crisis is driven by what? Any idea? Big corporations. It is driven by people burning fossil fuels. That is what's causing it. In order to change that, though, we need to transition away from that, and it has to be just so that there aren't people left behind in that transition. Anytime you have a major economic transition, people will be left behind, and we need to be very careful about how we do that. So, summary of call for actions. We need a low-carbon economy, and we need to phase out fossil fuels and shift to renewables. So, RNAO has been active on this, supporting things like Charlie Angus's Bill C-372 to ban fossil fuel ads to avoid misinformation. One of the biggest problems is misinformation, and that's in all things, but it's really strong. greenwashing is really, really strong, and there's a lot of money behind it. So, Una, back when you started nursing, what were smoking rates? 100%. Okay. 50% to 100%, somewhere in that range. Okay. What are smoking rates now?
I would think with the advertising and the banning and whatnot, less than 30.
So they're around 11%. Okay. And what led to that change? They banned advertisements for tobacco. So banning the misinformation is so key. So that's part of it. Reducing emissions. We need to reduce emissions to 40 to 45% below 2019 levels by the year 2029. That's 4 years away. That's really hard to do, but we have to start doing that. We need to be net zero by 2050. We need large public and private institutions, including finance, to disclose their climate impacts. And we need to collaborate with the feds on carbon pricing and other climate action. RNAO has also done something very important by working with Shift Action to decarbonize our HOOP pension plans. So put your hand up if you're on a HOOP pension. That's it? Who's working in the hospitals? Who has a HOOP pension? Okay, so there's more people there. It's a very dirty pension still, and RNAO is working to decarbonize it. So all the money that we invest, that's our money, is going to fossil fuel companies to finance their projects. We need to take that out so that it's not financing it. Clean energy transition. We need to phase out gas-powered plants, invest in renewables, not nuclear, promote dense and livable neighborhoods, expand public transit, halt new highway expansions, and retrofit homes and ban new fossil gas hookups. One of the work that our interest group is doing is we're working with the Say No to Gas plants. So Sarah, can you put your hand up? So Sarah and Matt Kelway, they're participating in that group for us. Okay? Halt new highway expansions. So in November, there was a bill that came out. And that bill got passed to put in highways in the GTA area, building over swamps and wetlands, and prime agricultural lands, which grows our food. So here is a question for you. Well, a little more background. Environmentalists were getting concerned and raising the alarm. So the government in power decided to create a diversionary tactic within the bill. What was the diversionary tactic they used to push this bill through?
Rob, was it an omnibus bill that was kind of hid these changes amongst other concerns, but I'm not sure exactly what specifically?
There was something about Toronto. Something very...
Was it the counselor, cutting counselors?
Not quite. Brenda?
It's about the gridlock in Toronto, is it?
And more specifically about the gridlock? How are they going to... What was very divisive?
Bike lanes.
Yeah. Rip out bike lanes, and while they're distracting over here, they're going to build highways over here. So that was the diversionary tactic they used, and it got the heat off of them from the highways and put it onto the bike lanes. So, Brenda gets a prize. Okay. Also, this government has done a lot of partnerships with Enbridge Gas Company so that there's more fossil gas hookups on houses, and it's became a standard of practice. And there's also talks about increasing gas-fired power plants. So we need to stop these things. Climate resilience. We need to collaborate on national climate adaptation and support municipal action, climate resilient infrastructure. Okay, so how many people heard about the flooding in Toronto last year? Anybody know what happened with the flooding? Well, a car kind of floating down the DVP and like the Union Station flooding in. Well, events like this are becoming more common, extreme weather events. We need to build our infrastructure with these weather events in mind. Okay, we need to build our hospitals that way as well, so that our hospitals, if there's a power outage, they have alternative, well, they do already have alternative sources of energy, but we have to build it so that there's these extreme weather events in mind when they're building all critical infrastructure. And then environmental protection. So talking about flooding, this government also decided to take away a lot of environmental protections on conservation areas. Conservation areas lay out floodplain maps. So they wanted to push building more houses, but not building in dense areas, but building where? In the Greenbelt and in floodplains. So these houses are going to flood. And on top of that, insurance probably won't cover them because it'll be hard to get insurance if you're building on a floodplain. So that doesn't protect homeowners as well. Also, when you're building and you're sprawling and building bigger and bigger and bigger, you're causing more congestion on our highways. You're causing more financial burden on taxpayers to build infrastructure out to those communities rather than keeping it in and having less infrastructure costs. So we need to build up, and not necessarily skyscrapers, but even medium density, rather than building out with big, giant homes and big, sprawling highways. So we need to protect the greenbelt, wetlands, and farmland, restore rigorous environmental assessments, empower conservation authorities, protect water sources, reduce plastic waste, protect vulnerable communities from environmental harm. And in protecting vulnerable communities from environmental harm, who lived through the smoke a couple years ago? I see like 5 hands. Was there only 5 or 10 people who saw the smoke a couple years ago in the summertime? I think all of Ontario was bad, but Northern Ontario was really bad. Yeah, Ottawa was bad. Was Toronto bad? It was everywhere. Yeah, Toronto did, and then New York blamed us. Washington blamed us, okay? So, air quality, but like our First Nations communities, they have smoke problems many times in the year. They have to get evacuated. So, Yellowknife got evacuated. That's tens of thousands of people had to get evacuated. Imagine having to evacuate Toronto. Okay? It was their capital city. It was where they have their tertiary care. Their whole hospital had to get evacuated and sent down to southern hospitals to be able to absorb that. We need to protect and we need to build infrastructure in such a way that has the climate crisis in mind so we adapt for the future. Okay. Doris, is there anything else you want me to cover? Oh, I can go on.
She's saying to me, how come he's not sticking to the 5 minutes? And I said, because I told him he can do 7.
I was only 3 minutes, wasn't I?
Yeah, like every politician I know. Okay, very good. So I have a question before I go into fiscal, or how can we pay for all of that? Do you think this is an issue of money, that we don't have in Ontario the money to pay? It's an issue of what? Greed? Political will. I think political will and greed. Political will from parties, greed from those that push them to care only about their small little piece of the pie, because it's getting smaller and smaller, that piece of the pie. And the majority of the pie is getting more and more empty. And so we will talk about fiscal and where to get the money. but we are going to hear from you rather than me here. So someone in the back, can you read that? And then I will interject with questions or comments, not in the back. Someone here, anywhere. Any that wants to just read? I'm not going to interpret, I promise. Okay, go for it. Here you go. Go for it. Thank you.
Progressive taxation. Collaborate with federal government to increase...
Dania, introduce yourself.
I'm sorry.
Say who you are.
Dania.
Say what representative in the board you are. Very good.
Dania
and where you
Versailles.
work also.
Oh, okay. Thank you. Dania Versailles, member of the board of directors. I represent Region 10, and I work at the Canadian Mental Health Association in Ottawa. Hi, Ottawa people.
And she also is leading one of our OHT BPSOs. Must say that. I
Correct.
need to say that. Correct. Go for it.
Okay. Thank you, Doris. Progressive taxation. Collaborate with federal government to increase taxes on high-income earners and wealth. Introduce wealth taxes on large inheritances and net wealth. Increase fairness by taxing population and enforcing polluter pay principle. Tackling tax havens. Closing tax loopholes and requiring corporations to pay fair taxes.
We will stop there for a minute. So, a colleague asked me some time ago when we presented this at the board, and after that there was many students also there. What do you mean? If I own a house, I will really keep even less in inheritance? Or if I have this income, will I have more of a problem? Let me tell you, to demystify for you, what's the reality of who we are talking. And I said it's the smaller percentage of the pie. So we are saying tax more. So progressive taxation, you know what it means. Whoever earns nothing or very little pays nothing in taxes. They're exempted. Whoever earns a bit more pays whatever percentage all the way to 50%. What we are saying, in addition to that, is that people above 250,000 need to pay more. We are saying wealth tax of net assets exceeding 10 million, for the person that was asking me, need to pay more. We are saying inheritance taxes on a estate over 5 million. We're talking huge amounts of money. None of us can even touch that amount of money in that type of inheritance, etc. But people that have that, they need to pay more. It's not just, this is how you come in the US, but also here, from a person that is born that already is way, way ahead than a person that worked all their life with big incomes. So it's impossible for anybody to even get a chance. So that's the amounts of money, just answering to a couple of colleagues that approached me, of what does it mean. Tax capital gains at the same rate as employment income. We're saying expand luxury taxes on items such as, and I don't know if any of you have it, please tell me so I get to meet you and you take me in your luxury jet. In your private jet, believe it or not, we have people. I know people that I have known that have it here in Ontario. This is not just in the US. This is not only Elon Musk, but people that have the luxury of a private jet, luxury cars. Some of those we will not mention anymore because we don't like the guy. Mansions and yachts, they need to pay more. We're saying close the tax loopholes. You all have heard in the news about those, right? And this is not for the person that is in an income and it goes through the income. This is for people in corporations that are making, I don't know, some of them 15 million a year in salary. You have people that are in realities that cannot even begin to see what's happening in their society. They live in a different planet, period. And those are the people that are getting the tax havens. So actually they can keep even more of the money, right? So we are talking about that. And then we will talk about, yes, Dot.
Yes, I'm Dot Klein, and I'm here actually with the Faith Community Interest Group, and I led the Truth and Reconciliation recommendations for the RNAO back in 2016. And it's built on respect. Honorable Murray Sinclair he was the commissioner that led the Truth and Reconciliation Commission. And I'm asking the RNAO, I've just sat here and listened, have you ever had Indigenous person or a Métis as the chair of RNAO?
You mean as the president of the board?
Yeah.
No,
Thank
but
you.
it's about time. That would be my answer.
So what?
And you have people in the board now that you could be talking to them.
So what I'm asking is, are you prepared, is RNAO prepared to lead forward where you're talking about the increase in fiscal capacity and lessening the income and wealth inequality for the northern and indigenous communities?
Yes, and it's in
is
the
it going
platform.
to be,
It's in the
just a minute, and is it going to be in a non-colonialism way? We have to, when you talk about relationships, it has to be respectful in all ways. And I wanted to bring this forward so that we remember the First Nations in this country. Thank you.
Thank you, Dot. But Dot, wait, don't take the mic. I'm not going to leave you off the hook that easy. It's not you or you, it's we. You are part of the we. There are board members, at least one that can run. I don't want to put pressure. That is Indigenous, very capable person. You go after them, I can't. As a CEO, I can't. But yes, we don't need an answer because we need to keep going. We have tremendous Indigenous colleagues. And yes, we never had an Indigenous colleague as president of RNAO. The time has come, go for it. Okay, let's keep going. Who is going to read the next one? The next one. Thank you, Dania, very much. Next one. Thank you.
Neil Stephen, I'm the Communications ENO for Sudbury District. Income supports and transfers, provincial supplements to federal transfers like the Canada Child Benefit, guaranteed income supplements, Canada Pension Plan, Old Age Security, and Canada Disability Benefit, as well as an advance towards universal basic income, ensuring a safety net for all.
Thank you very much. Let me give you examples so you have a reality check here. Ontario Works. Are you familiar with Ontario Works? For people in financial need, $733 a month if you're single. Get that, okay? $733. ODSP monthly, $1368 per month for a single individual. ODSP recipients have their benefits clawback. They have a clawback here in Ontario, as if they got too much money. So if the federal government, for example, if they receive the Canada Pension Plan and Disability Benefit and that goes up, then, well, guess what? we take some of that money back. The whole thing is backward. In July 2025, a new federal program, Canada Disability Benefit, of about $200 a month. The question is again, will Ontario claw back ODSP amounts for those receiving that extra benefit? You bet RNAO will be pushing that that cannot happen. So we are asking, number one, to stop all the clawbacks, to stop them completely, and to instead provide supplements over and above the federal government. Many of these programs, and parties, all of them, forget to say which that it came from federal program. They take credit for what the federal program gave, and in addition, they claw back money. That got to stop, and that's where we are going. Okay? Next one, please. Thank you.
Thank you. My name is Chandra. I'm the workplace CNO representing Region 7. So, employment and labor rights, guaranteed fair wages, benefit and pensions for part-time, temporary, and precarious workers, support full-time employment opportunities and improve job security, and enhance collective bargaining rights to reduce wage disparities. Thank you.
Thank you. So there is a very real reality, and you have seen it from time to time to play in politics, right? When we were pushing, so let me tell you a couple of things. Remember we spoke about Mike Harris yesterday night? That premier, 8 years, that stagnated minimum wage. Let's start there, please, right? No increase in minimum wage. I will never forget it. We fought it tooth and nail. 8 years, not a 0% increase. Then came the Liberal government. They did the increase. Then came Kathleen Wynne. She introduced both the COLA increase and the 1% on top of that. Then came the Premier Ford and kept that. That still has not been enough to keep what we call the working poor in poverty. Like people that are working, like people that get minimum wages, people that, remember, they are working and they're still poor. Working the 2,000 hours a week, a year, etc., still working poor. What happens is that when you increase more the minimum wage, which we are pushing for, and which the federal government, when we speak about the federal platform, I will remind you, the federal government did do for federal employees. But what happens here is when you increase, small businesses actually have a hard time. Small businesses, like a small restaurant, etc., not the big Walmarts. So then we do need to allow, right, to support small business to adapt to the increased labor cost and to give them a support if they need. This is the way Scandinavian countries do it. This is not magic. This happens. It's not RNAO fantasy land. It can happen in the context of today. And let me tell you, with the times that are coming that are even more challenging, given our friend or no friend south of the border, things will get tougher in that sense, and we will be pushing more and more and more on these issues. Questions for this? I would like a bit of even more reality. I know our colleagues in the north gave us this morning a lot of reality about what's happening in nursing, what's happening with students, what's happening in northern communities. I like in this community of us being here, and I am going to put her in the spot, but I don't think she will be surprised. Our colleague Una Ferguson to speak, if you don't mind, about Scott. Scott is her son. Thank you.
Hi, I'm Una Ferguson. I'm the chair of the Retired Nurses Interest Group and the communication for the Staff Nurse Interest Group. Okay. Let me tell you the story about Scott. Scott is 53, going on 54, and has lived with chronic back pain. He had scoliosis when he was 11. He had surgery for that, and he ended up with spinal deterioration, and he also suffers from severe, severe cluster migraines. I can remember him as a 2-year-old running around in circles screaming and having nothing to give him. He progressively got worse. In 2003, he took a drug reaction and ended up in a wheelchair. He has been on disability ever since. He was in university. Unfortunately, he was losing his ability to walk at the same time. He accidentally forgot to save his thesis. His computer crashed, and he crashed with it. And I had to bring him up from a severe depression because he said his whole life was eat, sleep, and take pills. Once we got through that, then he got onto we had to find housing for him. It's extremely difficult to find accessible housing. If you're ever asking for housing, it's accessible that you want accessible housing. There is no accessible housing, I don't think, very much in any community, Ottawa especially. There's a 10-year waiting list, at least, for disabled housing. Like that you have the countertops at the right height, you've had to go into the bathrooms, you've got things. So as a result, he's in regular housing. He's on disability. ODSP pays less than $14,000 a year. His apartment is over $1,200. Well, it's $1,400 now, almost $1,500. He does have a roommate who's 76, who also I take care of, but he's my daughter-in-law's uncle. But anyway, they are a good combination together, so I don't complain. But anyway, I'm subsidizing remember that nurses were only pensioned in 1987. So I'm on a pension, a nursing pension. I have got other money, but a nursing pension of less than 16, well, it's 16, it just pays my rent, so it's 16 something a month. It's very, very difficult. I'm getting up in age. I wonder what's going to happen when I pass on. He has got a brother and a sister, but they've got kids that they're putting through university. Money isn't going to be, they're not going to be able to put $600 a month out just to keep him in the apartment. His health is going to decline, and so what do we do? And it's a really sad situation. I worked for, but I was part of a group called Canadians Against Cuts for Social Assistance. And talking about the federal bill, we worked very, very hard to make sure that the first thing that bill wanted to do was, well, what were the punishments going to be if people abused it? And I thought, you haven't even looked at the people yet, and you're already worrying about it being abused. And this is the type of thing that the lawyers and that are really advocating for this group of people are up against, because they're fighting people who don't really have any problems and are living in houses and whatnot against people who don't have anything. And in that group, there were a couple of severely disabled people who were, there was one lady with MS who couldn't even get ODSP. I don't know what she was living on, but she was frantic. She didn't know how she was going to survive. And they do get desperate, they do get suicidal. And so I think what we have to really, really push for is to make sure that we don't forget this population. There are a lot of disabled people out there. They want to contribute to society. Scott considers himself, since RNAO came up, as the ODSP spokesperson for RNAO. And it's kind of funny. But he says, somebody apparently he met at a coffee shop said, "Oh, I saw you on TV." And he said, "How?" And she said, "Oh, I was looking through YouTube and I found you." But these people have to be heard, and they have to be listened to, and they have to really be noticed. And you have to think of, how do they exist? How is he going to exist when I can't hand out the $600 a month to pay for food and clothes? He's paying for rent. And that's about it.
Thanks, Yuna. Thanks, Yuna. That's reality, guys. So let me put you in reality also about policy and politics, today's elections. During the debate, 3 parties said they would double the next day the ODSP. We know the Premier said that they will not. He explained that they did increase and that is a COLA plus 1%, but 3 parties said they did. Marit Stiles said, I will increase ODSP the next day I am in. Bonnie Crombie, ECHO, I will increase ODSP. And you know that Mike Schreiner has said that for a long time. We are going to push those 3 parties to help RNAO to make this a reality. We ain't going to give away. Yuna knows that, our commitment to Scott. We sent Raul, I don't know if Raul is still here, but Raul, where? Okay, I still don't know him, don't see him. I know him, I don't see him, but that's okay. Raul went to Ottawa and did a documentary with Scott. It was all over the media. We thank him hugely that he agreed, and he agreed before. We went, of course, through Yuna. I didn't want to approach him directly, so he doesn't feel pushed for that. So we will continue to do that, Yuna, and we are going to call it the Scott increase when it happens, and it will happen. I want to ask, but only if you feel inclined to do that. Andrea, is Andrea somewhere there, Keller, sitting? Andrea, are you okay to share your story, please? Thank you.
Hi, I'm Andrea Keller, and I am the chair of the Kingston chapter. And I lost my son, it's actually the anniversary is coming up soon in March, in 2017, to a toxic drug poisoning. And so I've been advocating for change on how we deal with people who use substances. It's not only addiction now, it is also the toxic drug crisis and what is being put into our drugs. Nobody's immune to it. It's not just the homeless people on the street that you see, and a lot of those homeless people actually came from very loving homes. Some came from very traumatic backgrounds, but nevertheless, they're all human beings who deserve treatment. They deserve equal access to treatment, which they don't have right now. And we need to keep fighting, and I thank the RNAO for their platform and for fighting for the safe consumption sites, for harm reduction, for treatment centers, and really pushing the government. So, thank you.
Thank you for sharing, Andrea. And you already know that we are going to go to court. Will we win? I don't know. There are 8 different groups going to court. We can share the names with the organizations with you if you want. Our group has 7, I think, groups. In fact, today we were checking the factum with Matt. He and I are very involved on that, and I sign the papers and get very involved. And we have, you need to know, for many of these difficult situations and social justice situations, we are also very involved in intimate partner violence. We are also in a court case with that. For many of these very challenging social justice issues, topics, we get lawyers that do that pro bono. We don't pay. So is every single big legal firm needs to invest in community activities, and many of them either approach us. That was the case with the intimate partner violence. They approached us. And in this case, no, I approached several sites that provide the services now, and then they took it on, and they really took it on to levels that is fantastic. And the goal was always, if the government doesn't budge, if the government ends up closing, etc., that we will go to court. The Premier is aware. I always make the government of the day and opposition parties, for that matter, aware of what are our next steps, and that's our next step, and we are going all the way with that. Will we win? I don't know. But life is longer than 40 years, 8 years, etc. If the science one day will demonstrate that there are better ways than consumption sites, treatment sites, so be it. For now, we don't know that. We know that in Alberta is worse now that there is none. We know that in places that we know the services have been cut, like in Sudbury, Thunder Bay, and other places is worse. So we know that in Windsor, where our colleague Kathy Morland is there, is worse without that. So we will keep going based on the evidence and the values, both together, the evidence and the values forward. And if you want to know a lot more about this, please speak, stand up, Erin. He's a walking encyclopedia also that knows a lot. No, you? Yeah, you know a lot about that. Later on, if people want to talk with you or with Andrea, please do. And if you want to get involved in any or other one of these topics, please connect with us, because we are pretty engaged in all of it. Let's talk about federal now. Are we ready? We got a break a bit, so that's good. So we will go first with our Madam Doctor. Following. Oh, one more. This is in case, maybe you go back to it. In case you want the QR code for the platform, but if not, here, let me throw you ahead. In case you want to open it, that's the QR code for the federal. Yeah. So you can go there, or you can Google it, RNAO Provincial Platform 2025, RNAO Federal Platform 2025.
Thank you, Doris. We're having a great time, but the time is also going by. So we are now at the federal election platform for nursing from RNAO, and I'm hoping that soon and very soon that we will all see ourselves as RNAO. It's not what will RNAO do, it's what we will do. So let's try and move that one forward. So the federal platform for nursing is divided into 3 sections: the nursing staffing crisis, nurse practitioners, and healthy work environments. For the nursing staffing crisis, this is our ask: national task force to recommend safe nursing staffing ratios, targeted funding for health human resources, especially for nurse practitioners, RNs, and RPNs, competitive working conditions and compensation across jurisdictions and sectors, increasing full-time roles, reducing dependency on staffing agencies and casual work. We need to stop stealing nurses from abroad. We need support for Canadian-based, internationally educated nurses. There are thousands here. For nurse practitioners, we want to continue to expand their role in all sectors, especially addressing gaps in community care, primary care, long-term care, and home care. For healthy work environments, we need to address equity, diversity, and inclusion in the workplace. That falls on to ending workplace violence, which in healthcare environments, much of the violence is targeted against those who look different, who sound different, and we need to end that. Therefore, we need to enhance supports for staff mental health, and we all need to take time to listen to each other and support each other. You know that famous saying, we're only as strong as our weakest link? Well, we need to actually do something about that. Thank you.
So the federal election platform in terms of health system transformation and healthcare, I think it's just an extension of what we did on the provincial, except now we have to think nationally, and we need to advocate to the MP candidates more strongly because election's coming. So we need to uphold the Canada Health Act in terms of principle and spirit, where we are emphasizing that it sticks to the principles and the foundation of portability, accessibility, universality, comprehensiveness, and also that it should be publicly funded, right? Not-for-profit healthcare system is something that we always need to focus on. We need to expand the federal share of the healthcare spending, the funding that is allotted to various provinces, especially to Ontario, and leverage that so that we can enforce the Canada Health Act principles. Like, for example, when we are integrating nurse practitioners, midwives, and pharmacists into, for their services to be paid by publicly funded healthcare system, it means that we are aiming for increased access, and so that it becomes patient-centered. We also want to advocate that the federal and provincial or territorial agreements, they need to be outcome driven in terms of patient care and family-centered care and accessibility, and that we need to protect our healthcare system from the investor-driven healthcare organization. It is an easy fix for a lot of people. Like, I have colleagues who say, I would be ready to pay, extra, but that's not a good strategy in terms of long-term strategy, especially when we are looking at Ontarians provincially and also nationally. We want to focus more on the expansion and enhancing our Medicare or the publicly healthcare system in terms of in different areas, like we need to strengthen our public healthcare. This is that we already repeated when we talked about the provincial platform. We need to strengthen our primary care. Our health system should be anchored in primary care and public health system, and that we need to fund interprofessional team models based in primary care. So not only just physician-driven or not just one clinician-driven, but in terms of different professionals working together as a team. Mental health expansion and services should be provided to different communities, whether it is urban, whether it's remote. There needs to be some strategy put in place where everyone should have access to mental health services, young and old alike. The dental program that we talked about in the provincial, I think we need to continue to advocate for the expansion of the dental health care, so it is going to be there for sure for everyone, and including pharmacare. So pharmacare, it's already a work in progress. Let's just continue to advocate that it becomes universal pharmacare so that people who really need medications and who are not able to afford, who do not have benefits, are also covered in the system. These investments are long-term. Healthcare investments are never wasted, because a healthy society, a healthy community leads to a healthy country, right? At the end of the day, we are going to save our healthcare dollars in the long term. Similarly, for home care, we need to launch a national program so that people can get access to care in their own homes. So they don't have to depend on hospitalization and don't have to depend on long-term care. And that would be the best solution. Long-term care should be funded, but they should also be regulated. The safety standards, the ongoing regular monitoring and inspection should be done on a regular basis, because there are lots of for-profit long-term care that do compromise care, that we know. So I think that also needs to be looked at, and a national strategy to work for individuals who are equity deserving, right, is important. So having said that, I'm just going to leave that to my next colleague, Deb, to talk about the social determinants of health. That was quick, eh?
How's everyone doing? It's been a long day. We're getting near to the end. Thank you so much. So, federally, the social determinants of health, there's a lot of interlap and interplay. Each are extremely important. Housing, I think I've spent some time talking about that, but we all know with the transfer payments, the funding, a lot of it's coming from the federal government. So the louder we are at the provincial level with our association, independently, you all come from chapters, regions, you have your board representatives, there's the social action movement, what is it called, Doris, on our website, where you can mobilize. That's it, thank you. Leading Change Toolkit. I have 4 kids, and 3 of who are nurses, and I can't tell you how many times I've read that Leading Change Toolkit. But no, seriously, if there's something that is going on within your region, please use that toolkit, the social action movement, the theory, and mobilize and help affect and support what you're telling us to do here at head office. The toxic drug crisis, yes, you heard Andrea speak. Sadly, in Kingston, our mayor, knee-jerk reaction, shut down our center, our hub, because of an act of violence that wasn't even connected to the hub, but it happened nearby and closed overnight. All these people were displaced. It was awful. Indigenous peoples, yes, so very, very important. Our federal government is largely responsible to support the programs that are being delivered not only on reserve, but then through non-insured, off reserve, and so are the provinces. Equity, diversity, and inclusion, so very important. Charter rights for vulnerable groups, we've heard from Una, so many people are affected by EDI and the absence of the proper supports. Getting back to the Black Nurses Task Force, in their survey, 91% of participants said they had experienced racism in the workplace. So if you see it, you call it out. Or you can even meet with your directors and managers and weave it into your evaluations to say, I want to see this. I want better representation. I want the right supports in place. And then keep on your leaders, because really, it does come from here. But if we support it and move it up, some of those changes happen at the top level. Social media and AI, someone mentioned that earlier today. So very, very important. We're seeing that in healthcare in a big way. Scribe is one, and using AI, I went to the physician's office, said what was going on, into ChatGPT she went. It was rather interesting. And then gun control. So I met a new colleague today, Anash, and is a new graduate. And Anash talked about gun control, and in their work, the students, the awakening. Did I get that right? Project. I encourage you to go there, because we were talking about gun control because last night on, I think it was Global or CBC, a group of 75 young people. You know it's important when young people are organizing, going to a forum. They invited Mayor Olivia Chow. She refused, that's what the reporter said, refused to attend this forum of 75 young people who said, enough is enough. We are dying. We don't have enough to do. Give us jobs. Give us something that we can grab onto. Gun control, it's a federal issue, yes. RNAO is going to lobby and advocate, which we do very, very well. But we can, at the grassroots, much like this young group, like Anash, and writing papers, raising awareness, mobilizing, and taking action. Thank you.
So Lamo told me that I spoke a little long last time, and she wanted me to finish by 3:30, but I think we're already past 3:30. So I'll talk about my section, but I'll try to be a little more brief. And let's go to the next section.
Is that possible, Rob?
Probably not. This will be a challenge to finish quickly. Okay, so federally. So climate plan, we need to, emission reduction targets. So shrinking carbon budget, reduce the emissions by 40 to 45% below 2005 levels by 2030 and net zero by 2050. Again, 2030, that's coming up really, really fast. Carbon pricing and emissions cap, nationwide price on carbon and emissions cap on oil and gas. So there's a lot of movement right now on the carbon price and how that's going to be implemented. All the parties are playing around with that. So we need something, but we need something, but it is evolving. Clean energy transition, again, phase out coal-fired plants, phase down oil and gas, shift to renewables and clean energy technology. Thankfully, a lot of coal, we're phasing down most of the coal across the country, but Alberta did open up coal mining again. So we still have to stay on top of this. Sector specific, tailored plans for key sectors, including oil and gas, transportation, buildings, and finance. So each of these sectors needs a plan on how they're going to bring their emissions down. Adaptation, national adaptation strategy for climate resilience and lessening impacts of extreme events. There has been a lot of work done on this, but now a lot of those strategies have to be implemented, and some of those strategies have to be taken to other levels as well. Indigenous partnerships, integrate traditional knowledge and co-create and manage climate initiatives. International commitments, uphold the Paris Agreement, limiting rise to 1.5 degrees Celsius and fund climate efforts. Anybody know what the global average temperature was for 2024? Crickets? It's more than crickets, come on. Anybody? We're 1.55 degrees above. We already broke the Paris targets. So this is not a good thing. Other environmental policies. Conservation and biodiversity, so protect 30% of land and oceans by 2030. Strengthen environmental impact assessments, safeguard endangered species and habitats. There has been a lot of movement towards protecting 30% of lands. There was a UN meeting in Montreal a couple years ago, and that's where this number came from, and Canada has signed on to it. I'm not sure exactly where we're at in implementing it, but we're on our way. Pollution prevention and environmental safety. We need to reduce plastic waste, enforce polluter pay, promote circular economy, and regulate harmful emissions and chemicals. How many people do wound care in this room? How much waste do you make when you do change a wound? A lot. So healthcare, we're a dirty sector. We need to clean up our act just like all the other sectors need to clean up. Environmental justice, we need to protect vulnerable communities from environmental harm and ensure equitable access to a healthy environment. Lamo, did I make my time? Okay, I got the thumbs up for approval.
Excellent. So, as my colleagues were talking, and Rob in particular, remember one thing, and also in healthcare, when we were talking about health system transformation and why not supporting the investor-driven care versus the universal health care through the public purse and the public sector. Because here is what's happening, if not. You socialize the cost and you privatize the gains, right? That's simple. If it's a hospital, when you, Lamo, were talking about hospitals, the wait times, whether it's emergency room, whether it's for surgery especially, etc., you do the solution of investor-driven care. Investors, by law, they need to first provide dividends to the investors. That's by law. That's why they use that framework also. Versus a hospital like Sunnybrook, which has done it already, Toronto East did it also. They decided to extend significantly the hours of surgery. And yes, they brought more staff. And yes, they even paid overtime to the staff to stay. It cost less. And they basically paid from the public purse. And there is no someone else getting a kick out of it, a side dish of money out of it. So remember that piece. When people tell you socialized medicine, tell them, and what do you want privatized? So that you socialize the cost, meaning we give you the money from taxpayers and you privatize the revenues and the gain. Well, I don't want that, right? Because that's what happens. Let's talk about fiscal responsibility or fiscal, where will the money come? For any one of these aspects, for any one of them, you will have financial aspects that relate to that. Many of the ones we spoke before for Provincial were exactly the same, so I'm not going to repeat, except that one piece I want you to remember. When the federal government puts a program, what RNAO is asking, that at times that program even needs to increase the support, for example, minimum wage in the federal government, which is happening for federal employees. That's insufficient even at this time. And when a federal government puts a program that benefits everyone, like the Canada Pension Plan, etc., that may not be enough either. And when a provincial government supplements that, don't take money away from the other, because then you are still having people, whether it's people in ODSP or whether it's people in pensions that are living in poverty in our country, including nurses, I need to tell you, including nurses. There is one particular aspect that I do want to touch, because we may as a whole be less knowledgeable of that, and is the indigenous economic support, and also the support for other vulnerable populations. For other vulnerable populations, we gave examples, right? We gave examples of ODSP and other programs. But for indigenous communities, right? What does it mean? It means to work with communities to develop the programs that they believe is needed. So co-creation of them, and even better, is their creation, not ours, of any of us. And it also means that we provide targeted investment, land claims, and employment initiatives that are favoring, and it's not a wrong word and it's not a dirty word, indigenous communities. You heard from Julia, that presented about indigenous communities, and she told you the burden of illness and lack of access of indigenous peoples. Well, then let's push for programs that will benefit. So that is what RNAO will be looking. And this, in terms of the federal government, tomorrow we will be talking, because the elections have not happened. So on the provincial, we will speak tomorrow how to use our platform. So if you have a chance, do a little bit of a review today of what areas for your regions you want to pick. If not tomorrow, you will do that. And for the provincial, we will use it to mobilize. Two things that will happen tomorrow, and I need board members after that here. We will organize all of you by regions. However, if one of the groups wants to organize separate by chapter, go ahead. We will give you a table that is your chapter. So either region, depending how many people are, or chapter. You will have 10 minutes to prepare on a topic that is important to your region. And after 10 minutes of prepping, as if an MPP is coming or you are going to visit an MPP, one of the board members will come and sit with you. And not to chat that board member, and please try to role play because will help us to be ready for actually the first 100 days or for elections in the case of the federal government. That board member will play the MP or MPP role. You will not be able to choose unless we can figure out who will win each election wherever, but you should be able to speak with anyone. So if they come with the blue color here, you know which party. If they come with the green, you know which party. And if they come with the orange, you know which party, and the other, for whatever reason, serendipitous became fuchsia and not red because we couldn't find red. And you know which party, whether federal or provincial, go with both. If you have a chance, some of you love to get involved with Google and all of that, or with X, look at what's happening, especially federally. Provincially, you will know tonight, but federally, look what is happening because Carney is ahead in the polls, and look the attacks that the Polyev team is launching. Half of them made up ones, and there are very people dismantling the made up, but the fight will be vicious, I think, federally, when it starts after May. That maybe it will be the case, who knows. But March 9 is the selection of the liberal leader, likely, I don't know, I think it will be March 10, elections will be called, but I may be wrong. But have a look at what's going to happen, because we definitely need to influence the 100 days and the first year here in Ontario, provincial politics, but also here in Ontario, influence what happens with the federal one. Thank you. See you tonight.